Red Light Therapy, the complete guide to treating fat loss, anti-aging, muscle gain, hair loss, skin damage, and brain improvement with red light therapy. Written by Raphael Merrill. Narrated by David Michael von Neupert. Copyright 2019 by Raphael Merrill. Introduction. You likely must have seen an uptick in red lighting luxury fitness class advertisements lately peppering your Instagram feed. Or maybe it is the horror film Segway masks in plastic face that celebrities like Chrissy Teigen and Jessica Alba have flaunted to tip you towards that emerging trend of red light. If you wonder what red light therapy is exactly, how it works, and if you can benefit from adding it to your spa routine, join me as we take a wonderful tour of the light and learn more about this fresh, warm treatment in this book. Chapter 1. What is red light therapy? Red light therapy uses a red light that penetrates wavelengths directly through the skin of a patient. This is a painless, chemical-free process that does not produce heat, so that the light emitted does not trigger any discomfort if the surface epidermis comes into contact. During the treatment process, low red light levels are absorbed in the skin at a depth of approximately 6 to 10 millimeters. Red light therapy trials have shown that it can be used for the treatment of several medicinal foods and cosmetic disorders in the fields of neurology, physical therapy, and dermatology as a successful non-drug treatment technique. Research and historical timeline of red light therapy. Over the years, the use of red light therapy has been developed through the work and experiences of scientists all over the world. Although a relative newcomer in the Eastern medicine community, the roots of light therapy can be traced back to ancient times. It was the Greeks who realized first that exposure to light created healing properties that might aid in restoring health. In the early 1800s, the Danish scientist Dr. Niels Finsen was awarded the Nobel Peace Award for his efforts to demonstrate the positive effects of wavelengths in tuberculosis treatment. In the 1960s, European researchers found that certain single wavelengths have a significant therapeutic effect on tissue treatment through a photostimulation system. A good example of photostimulation would be the use of light for the treatment of newborns with jaundice, a common liver condition that causes the skin and eyes of a baby to yellow. A scientist named André Mester from Budapest made a major discovery on the results of treatment with low-power ruby laser in the late 1960s. Not long after the first functioning laser was invented, like other scientists of his era, Mester tried to use a high-performance laser to kill malignant tumors. Under the skin of laboratory rats, he implanted tumor cells and placed them in a personalized light. To his dismay, doses believed to be high-power laser energy did not destroy the tumor cells. Rather, he found that the skin incisions made to insert abnormal cells tended in treated animals to heal more quickly compared to incisions of non-lighterly control animals. The low-power light rather stimulated the skin to heal more quickly. Mester was one of the first researchers to discover how mitochondrial chromophores absorb photons in cells of the skin and how stem cell activation allows improved tissue repair and cure. The therapeutic value of red light was discovered in his research. It was investigated how different wavelengths of light can promote skin, muscle, nerve, tendon, cartilage, bone healing, and also denier and periodontal tissues. It was Mester's initial work that eventually led to the development in monochromatic light treatment for ongoing medical research, for which he had become a photobiomodulation father. Almost ahead of the 1990s, NASA scientists developed pioneering technologies using red lighting for space missions.
Sample complete. Ready to continue?